Okay, I'm ready to give my meds.
Okay.
So I'm going to start off. So my patient is Lloyd Bennett. He's a 76-year-old male, just admitted to the long-term care facility. I'm going to give him his AM PO meds, AM insulin, and flu vaccine. CBG was 206, heart rate is 77. His breakfast tray is already on the unit, so I want to get him his insulin so he can eat. I'm going to start out going through his meds with you. So he's got prednisone, 40 milligrams, PO, a corticosteroid to decrease inflammation, and he's got NPH insulin, which is an intermediate acting insulin. He's got a set dose of 35 units before breakfast. Sub-Q, regular insulin, 5 units, set dose, sub-Q before meals, and then a sliding scale. So based on his CBG level, I'm going to give him 2 additional units of regular insulin for a total of 7 units regular plus 35 units NPH. And regular is a fast-acting insulin. I'm going to give a total of 42 units insulin. Atenolol, 50 milligrams for beta blocker to decrease blood pressure. I'm going to hold for heart rate less than 50. His heart rate was 77, so we're good. And I'm going to give a flu vaccine, 1 milliliter IM, and give it now. Right. So I'm going to start pulling up my meds. First, I'm going to perform hand hygiene. I'm also looking, and I am just seeing his date of birth. I'm recognizing that he has no allergies and he's got a normal diet, diabetic diet. So I've got my labeled med cups I'm going to pull out, and I'll pull out his PO meds first. I am finding atenolol, 50 milligrams, PO, and the expiration date is good, and it's for the right patient. And prednisone, 40 milligrams, expiration date is good, and for the right patient. Next, I'll find my injectables. So I've got my NPH insulin, and it's a new bottle, so I'm going to make sure when I pull it out to date and initial it and check the expiration date, which we're good on. And then I've got my regular insulin, expiration date is good. Again, a new bottle, so I'm going to date and initial it, so it'll be good for about 30 days outside of a refrigerator. Also, I need to find the flu vaccine. So here I've got influenza A vaccine. IM 1 dose is 1 milliliter. Expiration date is good. Now, and I'm going to need my supplies. So I've got some alcohol prep pads. I've already got my med cups for my PO meds. And I've got a needle for my IM injection, 23 gauge, 1 inch. I've assessed the size of my patient, and this is the appropriate needle for an IM injection. And then I've got an insulin needle that holds 50 units, so it'll be appropriate for the amount of insulin I'm giving. And I want to make sure to label these, just like I've labeled my cups, so that I know that I'm giving the right medication to the right patient. Okay, so first I'll do his oral meds and get those out of the way, and then I'll draw up his injectables. So I've got my second safety check on my prednisone, expiration date is good, and med is good. In my labeled cup, I'm going to pop that and set that aside. And atenolol, my second safety check, expiration date is good, everything is looking good. Okay, so I'll set those aside with some water for my patient. Now what I'm going to do is draw up my meds. So I'll start with the IM injection. I've got my flu vaccine, second safety check, expiration date is good, dose is good. I want to make sure and clean the top really well. I want to make sure not to cross over the top as I've just sterilized it. So I've got my needle. I'm going to drop 1 milliliter of air. And inject that in. And then draw up 1 milliliter of fluid. 1 milliliter. cap. One hand. And place that back in my labeled package. Set that aside. Now I'm going to drop the insulin. The NPH, I want to make sure and agitate, and I'm doing my second safety check that I've got NPH insulin. And the expiration date is good. I've agitated that. I'm going to clean the top and do my second safety check on my regular insulin. So I've got regular insulin, and the expiration date is good. So when mixing these two insulins, I want to make sure and keep the mixing inside the syringe. So first, I'm gonna inject 35 units of air into the NPH insulin. Next, I'm going to inject 7 units of air. And I would re-clean if I knocked it over. Into my regular insulin, and then draw up 7 units. And I would have someone double check.
I see 7 units of regular insulin with no bubbles.
Great. And now I want to make sure and be very accurate when drawing up my NPH insulin so I don't get any of the regular into that bottle. And I'm going to draw up to 42 units. Is that my total amount?
All right. I see 42 total of NPH and regular.
Great. Set those aside.
I'll double check that that's right. And your CBG was?
206.
Right.
Set that aside. Now I'm going to put my meds away. Double check, third safety check on my influenza vaccine. Everything looks good. Same with my regular. NPH looks good. Put away my PO meds. Third safety check on my prednisone and my atenolol. Okay, so I've got my medications for my patient, some water. I have alcohol prep pads. I want to grab a cotton ball and Band-Aid for the IM injection. And I'm good. I'm going to wash my hands and go to my patient. Knock, knock.
Hello.
Hello, Lloyd. I'm going to provide for privacy and perform hand hygiene. How are you doing?
Okay.
Doing okay?
Yeah.
Alrighty. Well, my name is Jessica. I am your student nurse, and I've got some medications here for you today. Okay? First, I'm going to raise your bed up so that I can work with you. Lloyd, can you tell me your first and last name and date of birth?
My name is Lloyd Bennett, and my birthday was October 5th, 1923.
Great. Alrighty. And then, can you tell me if you have any allergies?
No allergies.
No allergies? Okay. I'm going to just raise the head of your bed here. I've got my medications and I'm going to keep an eye on them. So I've got some medications. I've got your insulin, your prednisone, atenolol, and a flu vaccine today.
Oh, my flu vaccine.
Yep. It's that time of year again. Can you believe it?
Oh yeah, I signed that permission slip, didn't I?
You sure did. So do you know what all those medications are for?
Well, one's for my blood pressure and one's for my COPD. It helps me breathe.
Yep. So I've got your atenolol is one of the pills. That's for your blood pressure. And then I've got your prednisone for your COPD to help you breathe better. Okay.
Yep.
So those are your pills. Would you like to take those first?
Sure.
Okay. So I'll give you those. And I've assessed your swallow and you're good at taking pills, huh?
Oh yeah.
Okay, there's your atenolol. Now here's your prednisone. Great. Next I'm gonna do your insulin. And do you know what your insulin's for?
Well, it's for my blood sugar. What was my blood sugar this morning?
Your blood sugar was 206.
Oh, that's not so good.
Yeah, it's a little high, so we gave you a little bit extra insulin. So
How much extra?
help you out. 2 units extra. So we've got a total of 7 units regular. That's the fast one, remember. And then we've got 35 units of your NPH, and that's the kind of intermediate one.
Oh, okay. That's what I
Okay.
take every day.
Yep, that one's every day. And then I know your breakfast tray is on the floor, so that'll be in just a little bit, okay?
Good.
Okay. So you want to start with your insulin or your flu vaccine?
Whatever.
All right, let's do your insulin first.
Let's do it in my belly.
In your belly? Great, that's where I was headed. I'm going to just expose your belly here, okay? You doing anything exciting today?
Oh, just watching TV. Kind of a mellow day.
Kind of a mellow day.
Now, the last nurse, it really pinched, so
Oh,
I don't know what she did, but...
well, that's no good. What I'm going to do is I'm going to go just about 2 inches away from your belly button, outside of your belly button, and I'm going to rotate it. I saw that she gave it in your left side of your abdomen yesterday, and so I'm going to give it on the right side of your abdomen today, okay, to keep that tissue nice and healthy.
Okay.
So I've cleaned that site, and I'm going to let it dry for a second. Okay, are you ready?
Yep.
Okay, it's going to be just a quick pinch. I'm going to squeeze and insert at a 45-degree angle. How's that? We're all done.
Nope, that didn't hurt at all.
Well,
I like that.
good. I'm glad. Okay, are you ready for your flu vaccine now?
Oh, yeah, we're going to do that in the arm then, right?
Yeah, I can do it in your arm. Is that where you'd like it?
Yep.
Okay, great. Just cover your belly back up here. And bring it over here into your arm. Okay. So again, I'm going to just, and I've got a little cotton ball in case you bleed a little bit, so I can put some pressure on it afterwards. I'm going to clean you first, and after I find your site, I'm going to look for your acromion process, and then I'm going to go down about 3 finger lengths, and I'm right across from your armpit, so I'm going to give it to you right there. How's that sound?
I guess.
You guess? All right, so I'm going to clean that site. Are you ready? I've let that dry.
I'm a bleeder, so...
You're a bleeder? Okay, here we go. There we go. We caught it. I'm going to
I'll
put some
hold
pressure
that.
there. Oh, thank you, Lloyd, for the help. Okay, so that's it for your medications. Anything else I can do for you?
Well, am I supposed to hold this all day?
Well, I'll just put a Band-Aid on it. How's that sound?
Okay.
Okay. There you go. Is that better? All right. I'll see you later, Lloyd. Your breakfast will be in a moment. Okay. So I'm back at the med cart, and I'm going to document my medication administration. So I gave prednisone, 40 milligrams, NPH insulin, regular insulin sliding scale, Tenolol, and the flu vaccine. I'm going to turn it over, and I'm going to say how much insulin I gave and where I gave it. So my first one, so 730, blood sugar level was 206, and I gave NPH insulin 35 units in the lower right quadrant. And then I'll sign for my regular insulin. I gave a total of 7 units in the lower right quadrant. And then I would initial here and sign my name, C-U-S-N.
All right, so how'd you feel about that?
I felt it went pretty well.
Yeah, it did. It went really well. The only thing I just wanted to point out is, or ask you why you did not Z-track for the IM injection in the arm. Remember why?
So I did not Z-track because it's not a very deep injection, and the flu vaccine isn't a very caustic medication. So, and it's not a lot of medication. I only gave a milliliter of fluid, so I just gave it in the deltoid.
Yeah, so if it was in the hip or the
Mhm.
leg, you would have Z-tracked.
Yeah.
Other than that, I think it went fairly well. It does say here, write your name on the board, but that's okay.
Okay.
Just something, you know, if we had a whiteboard in long-term care, you usually don't.
Okay.
And that's it. It went really well.
Great.
Yeah.
Thank
Thanks.
you.